what is the difference between irritant contact dermatitis. So from now we will call it as ICD, and allergic contact dermatitis we'll be calling it as ACD. Fine. So what is the mechanism in ICD? This is usually due to innate immunity. It is usually due to innate immunity. Whereas allergic contact dermatitis is usually due to type 4 hypersensitivity reaction. Type 4 hypersensitivity reaction. Now, how does a patient present to you with the irritant contact dermatitis? Now, in this case, the patient usually presents with complaints of dryness and irritation over the skin. Dryness and irritation over the skin at the site of contact. At the site of contact. So that is the usual presentation of irritant contact dermatitis. Now what is the usual presentation when it comes to allergic contact dermatitis is patient usually presents with complaints of a acute eczematous rash. So what is an acute eczematous rash? An acute eczematous rash means there is going to be a red skin along with some vesicles over it, isn't it? So that is an acute eczematous rash, but this usually developing at the site of contact on repeated exposure. On repeated exposure. Now this is the usual presentation of allergic contact dermatitis. Now what is that you have to understand is, in the case of irritant contact dermatitis, the usual allergen is going to be chemicals. Now what are the chemicals? Like it can be any organic solvents, it can be detergents, it can be dishwash, etc. So let me give you one of the example. Like we were using hand sanitizers, isn't it? Especially during the COVID pandemic times. So when we were using hand sanitizers, did you ever notice that our skin was becoming dry and you were feeling some irritation as well? So this is a chemical. So now this is going to be a irritant contact dermatitis. Whereas in the case of allergic contact dermatitis, what happens? The patient is not complaining of any problem or any symptom during the first exposure. Not even during the second exposure, but during multiple repeated exposures, the patient is going to develop a skin rash. Now, what is the commonest example? Like for example, I bought a new wristwatch. Now, after buying a new wristwatch, I do not have any symptoms. I'm all happy. But what happens once I start using the same wristwatch? So for probably 3 days or 5 days or even a week. So within a week, what happens? My body starts reacting and there is some memory T cells that is produced, and one fine day there is some eruptions over the skin. So does the patient understand that this is due to an allergy to the wristwatch? Absolutely no. Because the patient always feels like I was using this for the last 1 week without any problem. Then how can my body be all of a sudden allergic to this? Now the answer is here in your screen. Why is the patient developing this kind of a rash after repeated exposure? Yes, the answer is because this is a type 4 hypersensitivity. Now what is type 4 hypersensitivity? It means delayed type hypersensitivity. So always remember, this thing has been noted in red because the patient of allergic contact dermatitis always develops rash not during the first exposure but during repeated exposure. Now this is the difference between ICD and ACD. Now let us see some of the examples now. Now what you see in this image right now on the screen. So is it ICD or ACD? So from this image itself, you can see that there is a dry skin over the palms, isn't it? So this is going to be hand dermatitis. So this is most commonly a irritant contact dermatitis. Now what is the most common culprit for this hand dermatitis? The most common culprit is going to be detergents. The most common culprit is going to be detergents. Now if detergents is going to be the most common culprit for hand dermatitis, then which is a category of patients who may present with this symptom? So the category of patients who may present with this symptom is going to be housewives, isn't it? Hence it is called as housewives eczema. Hence it is called as housewives eczema. So this is the most common cause of irritant contact dermatitis. So this is the most common cause of irritant contact dermatitis. So all these are important points. Now let us see another example. Now what has happened to this patient? So in this patient you can see that the patient has developed an acute eczematous rash over the center of the forehead. Now what is the clinical significance? Center of the forehead means the patient has used something, there is a contact dermatitis, and the most common culprit is going to be bindi. So this is called as bindi dermatitis. This is bindi dermatitis. Now in the exams they may ask you what is a culprit for this kind of an allergic contact dermatitis. The patient used it once, there was no problem, but on repeated exposures this patient would have developed the symptom. So this is again an example for allergic contact dermatitis, and the culprit here is going to be PTBP. Now what is PTBP? This is para tertiary butyl phenol. So para-tertiary butyl phenol is going to be the culprit in bindi dermatitis, which is again a type of allergic contact dermatitis. Now let's move to the next one. Now what is the culprit here? So obviously from this image it is clearly visible that the patient was wearing rubber slippers. Now after wearing rubber slippers the patient developed this kind of an eczematous rash at the site of contact. Again this must have happened after repeated exposure, so you can call it as footwear dermatitis. So you can call it as footwear dermatitis, again a type of allergic contact dermatitis. Now going to the next one. So this is again another good example of an allergic contact dermatitis, because the patient may have some dermatitis to a metal. Now what is a metal here? This is going to be nickel dermatitis. Nickel dermatitis. So this nickel is going to be present over the buckle of a pant, okay, also present over the belt. So all these things can cause these kind of eczematous lesions around the umbilical area. So at that time you have to again suspect allergic contact dermatitis. So this is also an example of allergic contact dermatitis. So another examples would be someone just like the example which I have given you with the wristwatch, and also this is another example. So all these things are going to be allergic contact dermatitis. Remember, artificial jewelry is also going to be allergic contact dermatitis. So out of all the examples which I have shown you, I was just trying to make you familiarize that the most common cause of irritant contact dermatitis is always a chemical. So on the day of exam, if they tell you about detergents, organic solvents, or a dishwash or anything as such, the answer is always ICD, and remaining everything most likely that is going to be ACD. Now all these are the examples. So this is what I have already explained: organic solvents, soaps and detergents for ICD. And when it comes to allergic contact dermatitis, there are multiple options like rubber, dyes, cosmetics, metals, cement. So in one of the exams they had asked you what is a culprit in cement that causes allergic contact dermatitis. Now what is a culprit in cement? The culprit in cement is going to be potassium dichromate. So this is going to be the culprit in cement which causes allergic contact dermatitis. Now among all these things, please remember housewives eczema, which is due to detergents, and this is the most common cause. And in footwear dermatitis, it is usually caused due to PPD, that is paraphenylene diamine. And bindi dermatitis, the culprit has been explained to you, that is para-tertiary butyl phenol. So all these are the various examples of ICD and ACD.